Hello and welcome to the Net Zero Health and Care Pathway tool, designed to support the NHS in achieving net zero emissions by 2040. This user-friendly, scalable solution integrates with NHS systems to track patient activity, emission factors, carbon inputs, and CO2 outputs, providing actionable insights across community, emergency, hospital, and outpatient care. It enables organizations to identify carbon hotspots and associated costs, develop targeted sustainability initiatives, and monitor progress toward emission reduction goals, ensuring a cost-effective and impactful approach to healthcare sustainability. This data-driven solution offers comprehensive carbon reporting, scalability, and financial integration, aligning with SECA, ESOS, TCFD, and the Carbon Reduction Plan to ensure NHS compliance. Non-compliance risks financial penalties, reputational harm, and operational setbacks. Let's get an overview using the asthma pathway as an example. The tool supports vertical exploration, analysis by sites, sectors, or services, for example, primary care, ambulance services. Horizontal exploration, emissions and cost analysis across clinical pathways, for example, asthma, for a holistic view. In this demo, we will provide a quick overview of the tool's standout features using the asthma pathway illustrated before. The landing page serves as the starting point, offering intuitive navigation links to all key functionalities. Users can explore individual modules or sections and create clinical pathways and emissions data in a seamless and user-friendly manner. Next, I'll navigate to the New Pathway Assessment tab, where we can set up and customize a pathway. On this page, users can create and customize clinical pathways by inputting the pathway name, code, start year, number of patients, and other necessary details. For example, a clinical pathway provides horizontal cross-sector insights, linking primary care, ambulance, and secondary care or other modules as applicable, while vertical module-specific analysis offers deeper insights within each area, such as virtual and in-person consultation emissions within the primary care module. Once the pathway is created, the next step is to understand emissions data. Let's switch to the Emission Factors tab. This section incorporates up-to-date, globally standardized default emission factors and associated activity cost for individual patients across all modules, eliminating the complexity of manual calculations. This ensures precise emissions tracking and benchmarking while reducing effort. Users can also input standard benchmarks or customize values to meet their organization's specific needs. Next, I'll switch to the Section Summary tab to take a closer look at the consolidated data. The Section Summary page provides an overview of emissions and costs, highlighting total emissions per patient, carbon intensity per patient. These insights help users identify carbon hotspots, whether horizontally across clinical pathways or vertically within specific modules, informing the design of effective reduction strategies. Each module, such as patient self-help, primary care, emergency pathways, and continuing care, offers granular data for vertical exploration. For instance, the ambulance module enables a detailed analysis of emissions and costs specific to each pathway within ambulance services, including Hear and Treat, See and Treat, and See, Treat, and Convey pathways. Let's dive deeper into one of the sections further, taking primary care as an example. The page provides a brief overview of some key metrics like emissions per patient, carbon intensity per patient, cost per patient, etc. Scrolling further down gives us detailed numbers and figures, giving us data on the granular level for vertical exploration within primary care services. Now, I'll navigate to the Emissions Summary tab to review emissions and associated costs in a visual format. This page visualizes emissions and associated costs through dynamic charts, comparing scenarios with and without sustainability initiatives. It tracks monthly and yearly trends, providing a clear picture of the impact of initiatives on emissions and costs, as well as progress toward NHS net zero objectives. From here, I'll switch to the Initiative Management tab, where we can set and monitor sustainability targets. This section is central to developing and monitoring sustainability efforts. Users can add initiatives by using Add Initiative Item button and entering relevant details, Set reduction targets for emissions and costs. Focus on module-specific hotspots, such as vehicle emissions in ambulance pathways. Track the cumulative impact of initiatives over time. To measure long-term impact, let's switch to the Sustainability tab. This page offers a comprehensive view of emissions and cost reductions over time. For example, emissions from the asthma pathway could decrease from 52,386 to 26,822 with targeted initiatives. It also provides an overview of the total cost for carbon emissions with and without initiatives. Let's talk about the benefits of the tool. The tool delivers a strong return on investment by improving social value, clinical quality, population health, and resource efficiency. It achieves a 15 to 20% reduction in vehicle emissions and a 10 to 15% drop in hospital admissions, driving cost savings and operational efficiency. Real-time compliance tracking and actionable insights support NHS Net Zero 2040 goals and CQuIN measures. A 10% resource reduction on a £100 million budget saves £10 million, offering a £2 to £3 return for every £1 invested. Aligning with the Triple Aim agenda, the impact measurement approach integrates social value and care delivery, driving sustainable improvements across social, environmental, and economic dimensions. It empowers the NHS to achieve net zero by 2040 while delivering value to patients and communities. Ready to take control of your NHS trust or hospital's carbon footprint? Sign up now and lead the way toward a more sustainable future. Contact us at agem.integrated-planning@nhs.net.